Today I'm going to talk about assessing patients for literacy level and learning styles in order to design a patient-specific education plan to increase and maintain high quality of life. How many of you have seen or heard a patient's name and said, "Mr. Smith is back again? What's going on with him now?" Have you ever thought that nursing could have prevented that patient's readmission? I'm a registered nurse specializing in patient education. I have been educating patients in many facets of healthcare for 10 years. I have worked side by side with many of you, and we have trusted and supported each other through many situations. I hear your frustration over limited time and the lack of self-care knowledge that our patients possess. I know that we as nurses want to provide quality education to our patients in a short period of time that we have with them. As nurses, you do really know how much your patient has learned from your education in order to take control of their self-care. Today I'm going to talk about assessing for literacy level, learning styles, assessing your patient's specific needs, their knowledge base, and applying information to educate your patient. Let's talk about what health literacy means and the prevalence of literacy in our population. What are the patient and nurse barriers? According to Penny Glossman in an article published by Health Literacy, literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to appropriate healthcare decisions. In the United States, approximately 36 adults have limited health literacy. 14 are below basic health literacy. Patients with low health literacy feel ashamed, hide their inabilities, and do not ask health questions. According to an article written by Ruth Parker in the Oxford Journal of Medicine titled Health Literacy, this is a challenge for American patients and their healthcare providers. Low literacy has been associated with decreased medication adherence, medication errors, little or no knowledge of chronic disease, high readmissions, low self-care management, and lack of preventative care. Both low functional and health literacy goes unrecognized in the United States. Most nurses are really unaware of the magnitude of patient illiteracy and how it affects patient outcomes. I would like to talk about how we should assess our patients to target education. Assessing a patient's literacy level and how to teach your patient. First, let us assess the patient literacy level. This can be done by a simple reading, giving your patient something to read and then assessing their ability. Ask the patient how they learn best. Are they a visual learner? Are they an auditory learner, a hands-on learner, or a read-write? This is in your packets, and this goes through and explains how best to teach a patient when they say that they're more of a visual learner. Comes from Online College. Understanding learning styles can help maximize your teaching ability. Now let's look at styles and teaching called Teach Back. According to Ping Su article in American Nurse Today, using Teach Back to assess patients' understanding of educational topics by using open-ended questions to ensure patient understanding. Teach Back should be utilized to perform very quick assessments and evaluations of what the patient knows, understands about their disease. Asking your patient questions with open-ended questions about diet, exercise, and medications. Divide the topics into 3 plans. Most patients are admitted for 3 days. And then you would use a team model. This is a logic model for health literacy systemic review, and you also have this in your packet. According to Barbara McNeil, an article titled "You Teach, but Does Your Patient Really Learn?" in a North Carolina Nursing Association magazine, reveals patients for effective teaching. It is vital to evaluate your patients. We need to assess the patient's knowledge, design education plans specific for the patient's needs, and use readback when educating patients and reassessing patient knowledge. We educate patients every day, so let us be more successful for our patients. Let us not hear whispers about readmissions. Wouldn't it be nice to hear our patients thank us for what we've done and how we've educated them? Doesn't it feel good to know you've made a difference in someone's life? In closing, I have expressed concern for our patients' decreased quality of life due to assumptions of nursing believing patients understand information being given to them. It is important to assess your patient for literacy level and learning styles in order to design a patient-specific education plan to maintain high quality of life. As nurses, we always want the best for our patients. Our patients deserve high quality of care. We all receive packets that have the learning styles, read back, and websites that you can do further research. And knowing your patient needs and use read back to educate will take less time than the process we use now. I leave you with this question. Do you really know how much your patient is learning from your education?